Welcome back. As the pandemic rages on, we are now getting data on those who have recovered from COVID-19 and realize that it isn't just like the common cold or flu. Some people are having long-term symptoms and others have long-term organ complications. So here to talk about this is our 9 Health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. So what can you tell us about these, quote, long-haul patients?
Good morning, Natasha. So these long-haul patients are a subset of patients who have COVID-19 who are having symptoms that are lasting longer than 4 weeks. And most of our data is coming from the Mount Sinai Post-COVID Care Center, which so far already has over 1,000 patients. And what we're learning is that the median age of these patients is 42, so relatively young patients. 80% of them are women in the Mount Sinai cohort. And many of these patients had only mild to moderate symptoms with the initial infection. And what we're seeing are symptoms such as fatigue, shortness of breath, heart racing, really an inability for these patients to return to their life as before. And this is not a result of them persistently being infectious, but is instead a result of probably some long-term damage caused by the virus. And scientists don't yet know exactly what that is, but they think the mechanism is possible damage to the nervous system that regulates our heart rate, regulates our breathing, it regulates our metabolism. That still needs further investigation.
A virus is far more damaging than we first initially thought. There are some reports of hair loss in patients as well.
Yes, this is something we're also seeing. It's a condition called telogen effluvium. And essentially what it is damage to the hair follicle that's occurring as a result of emotional or physical stress, the infection, the fever, the weight loss, any of the stresses associated with COVID-19 infection. So normally our hair, 10% of it is in the shedding phase, so it's falling out actively. When you have telogen effluvium, you have over 50% of it in the shedding phase. So you really get hair loss all over the head, and you're losing up to 100 or more hairs a day. It can be obviously very distressing, but the nice thing about it is short term, and hopefully the follicle recovers once the stress is cleared.
Wow. Well, a new study came out this week about long-term inflammation in the heart after COVID. Can you tell us more about that?
Yes, this was another kind of concerning study. So they took 100 random patients who had contracted COVID and recovered, and some of them had very mild symptoms with the initial infection. And they did a test on them called a cardiac MRI, which looks really closely at the cardiac tissue. And what they found is that 78% of those 100 patients had an abnormal cardiac MRI, with 60% of them showing signs of active cardiac inflammation even 2 months after their initial infection. So that's another surprise that we weren't expecting, particularly because some of them weren't even having cardiac symptoms.
Yeah, a lot. We cannot take this disease lightly, obviously, with a lot of long-term effects. Dr. Kohli, thanks so much for joining us.